Hey, this is Nick for discussion number 6. We're talking about opioids and dependence on narcotic medication. So the question prompts asks what assessment findings and what behaviors do you see in patients with opioid addiction? What are the best practices to deal with opioid addiction, and how do you address substance abuse? So the first, what are the assessment findings of prescription drug abuse? Increased anxiety, insomnia, uh, itching, chronic constipation, high high blood pressure. Some things to look out for in a possible, if they come in and they're acutely intoxicated with opioids, they could be hyper alert, and just hyper vigilant. Some Obviously, if a person is overdosed, they're going to have constricted pupils, decreased respiratory rate, decreased alertness. But the reason that patients seek out opioids and become addicted to them is related to the action that the opioids have on the central nervous system. You have three main receptors: the delta, the kappa, and the mu receptors. These occur throughout the body, and then when they get activated, they release endorphins. This produces a high, or gives you euphoria, and controls pain. Um, this can quickly become addictive just due to the amount of euphoria that they feel. This Then the receptors, they like to be they have an affinity for the opioids, and when they're not, they produce some withdrawal symptoms, which could be anxiety, sweating, tachycardia, and shakiness, and questionable seizures as well. So moving on to what behaviors that patients demonstrate when abusing opioids, there it centers around getting the opioids or getting the narcotics. Um, they forge signatures. They quote get them stolen, and come in and try to obtain multiple prescriptions of the same medicine. Steal, sell, basically do anything to obtain the narcotics. And again, this is related to the sense of euphoria. They're constantly chasing the high that they want. So, once you determine through your assessment finding that someone's addicted, and what is the treatment? Obviously the main one is prevention. So preventing someone with chronic pain from getting addicted to medicines is a key factor to keep them from doing those behaviors, becoming depressed. Just it's not a path that a lot of people want to go down. So prevention is a key. So it's some things that I read. You could use opioid risk tools. One is actually called an opioid risk tool, ORT, and the other is a current opioid misuse tool as well. There's a lot of those out there to give you an assessment tool to figure out if your patients are abusing them, and then if they are, you can talk and manage that with them. And another one is pain contracts. Just basically setting out, hey, you have some persistent pain, so here's some things we want you to do. Just don't get any other pain medicines anywhere else. Call us, and being open and honest with your patients can help as well. Just letting them know, like, hey, this is, it's common. It's nothing to be ashamed of. And if you have problems with it, alert us and we can, help you out with stuff. So the actual treatment, if someone does become addicted or who is currently abusing, um, the main stickler with that is that patients, they must be willing to change. They're the ones that are going to have to be the ones that say, hey, I see this as a problem. I want to change it. Because without that, you're really spinning your wheels with any type of other treatment. Because if they're in the mode of chasing their high, then they're going to continue that until they feel it's not in their best interest. So, pointing out why opioid addiction is not a good road to go down is key to that. And if a patient does, take that step and say, "Hey, I want to not become addicted," there are a couple things to do. One, some counseling therapy, behavioral therapy, and using the opioid agonist. So they act similar to they bind to the opioid receptors and they give a similar effect, but they do not have some of the adverse effects that opioids do. So that's some of the treatment. And the next question was, what do you do about if you have a patient that is having these pain issues. So in my, I'm an emergency room nurse, and so what we do, is it's hard we see these patients all the time, coming in trying to obtain, narcotics, either because their doctor has stopped prescribing them or, they're just in the mode of getting as much as they can, trying to sell it, trying to get other drugs, that type of thing. So in my, it's all how the provider really wants to address it. Some, or we'll just give them what they want to get them out quickly. I don't, obviously that's not a ideal situation, but in a busy ER, sometimes that's what happens. Another one is they basically say, you're not, I'm not giving you narcotics and get out. That's the other end of the spectrum. And some will try to help. They refer them out to, pain clinics, and they will give them a short dose of the agonist, and tell them to follow up and get them in touch with the social worker. So those are some things that typically happen. Yeah. So it's an interesting discussion. It was, something very relevant to my practice, and yeah, looking forward to everyone's responses. Thanks.